Hello, how are you? We are here at Nagalare.
Nagalale.
In Uganda. It's
not India, guys.
It's not India. So, welcome to the podcast today with Vibes with Dr. Ruth Grace. And today we have one and only
myself. Hi everyone. My name is Martha and I'm here chilling with Dr. Ruth.
Yes, and this week is Safe Motherhood Week. We agreed we're going to do a podcast about safe motherhood and self-care. So this week we're going to be talking about safe motherhood. And well, if you've been following with our previous podcast, you can actually link up and you will know that topic that's coming up.
Yeah.
We've been talking a lot about discharge what? Now, someone asked a question on our TikTok page and said, how long does this discharge come after you've given birth? Now, we are here to answer that question.
We are here to answer that question.
Especially
like doctor. I'm here to chill, guys.
You know, Martha is a code doctor today.
I'm the experiential. She's the expert.
So Martha is going to share with us her experience, well, if she wishes to. However, she's a mother and she can tell us more about that. Yes, but she's a very beautiful mother. Some may not know. But she's going to tell us about that. And, well, what happens after birth? Do you want me to tell you what happens after birth, or you want to tell me your experience?
Let me first shock you, and then you tell us.
Okay, please shock me. Shock me.
Thank you.
Can I still absorb more shock? I don't know.
No, I don't think.
Oh, dear viewers, we're not talking about the shock.
Yeah.
We're talking about
surprise.
Yes.
Yeah. But I don't. At this point, I don't think doctors have anything that surprises them.
Well, we do.
Sometimes.
Oh, yes, we do.
This won't.
Okay.
As Ruth has mentioned, I'm a mum of a 1 year old. Hi, Naya. I realize parents do those things.
Oh, yes.
Hi, baby. They can't see you. But when they see this one.
Now you're one of them.
I'm one of them. But my experience was we encouraged a lot of times to get as much information as first-time mothers and everything. But I think too much information is also not good.
Yeah, and
because
first-time moms always have too much information.
Thank you. Like, we are everywhere.
Everyone is always sharing as well.
It kind of changed my expectation, what I was expecting and what actually I experienced. First of all, I was one of those moms that are like, guys, I'm going to push this baby. I'll go do it.
And then what happened?
I have done everything.
After all that YouTube motivation.
You guys, I did yoga. I learned yoga when I was 5 months pregnant.
Did you go
not
leg
that
up?
one. Not that one,
okay.
sister.
Okay,
Yeah.
good. Okay.
The stretches.
The number one.
Yeah, like just... the stretches. Those ones. I did a lot of those.
Yes.
But when it came to the D-Day, I didn't. I didn't get the opportunity to do the pushing.
Yes.
But I think what helped me is I had an open mind.
Yeah.
I had an open mind to it. What I cared about most is not how I'm excelling at giving birth, but rather how my child is doing well and okay.
Well.
Yeah. So the discharge part, I think for me, it was the bleeding that I was completely blown away by.
So how long did it take?
2 weeks.
2 weeks.
Yeah.
Okay. And then after that, you didn't have any other spotting or anything?
A little bit. No, the 2 weeks were basically the whole bleeding and then the spots.
Okay.
And that was it.
That was it.
Yeah. That part of postpartum was actually smooth for me, guys.
Okay. Congratulations. Well, not every mother has a smooth postpartum.
Sure. Yeah.
And it's very important to note that every pregnancy journey, every pregnant woman has their own journey.
Thank you.
Whereas it is okay for someone to share that, I went through this, my body did this, your body is your autonomy. That is the truth. Your body is yours. And also the truth to it is that your own pregnancy is your own pregnancy.
And
so
it's
just
different.
because your sister pushed, just because your mother pushed you, does not mean you may end up pushing a baby.
Thank you.
Or just because your mother was actually operated,
doesn't mean you can't push.
Exactly, that means you can't push a baby. So you have to always be open when it comes to pregnancy. And I'm glad you are open about that.
Yeah.
So
less stress.
I'm curious, did you get any discharges during pregnancy? Because those also tend to happen. Discharge during pregnancy happens, okay?
Yeah.
And it can actually increase up to a point where you actually have to wear a liner almost every other day.
Thank
you.
you.
It is a normal thing. It happens.
At some point, I was not sure I didn't pee on myself.
Exactly. Most times people think they've peed on themselves.
Yeah.
And by the way, you brought that up. It's very important because usually when no man tells us, I woke up or maybe I was at work and I felt wet.
Yeah.
It's not bleeding. They just felt wet. We always ask the question. One is, always come to hospital. It's the first thing, because most women do not know. One, is it a discharge that's from my private parts, or second, is it just sweat? Some women sweat a lot during pregnancy.
Oh yes,
and that happens.
Oh yes, I didn't dress up.
You didn't dress up. Yeah, and that is why bambi batambula bukunya. It is okay.
Forgive them.
Forgive them.
They're on fire.
Exactly. By the time they come to us, actually they tell us Musao, nyamba deka deno kubanga just don't go accident sagala. Nay, it is okay.
Yeah.
But it's okay.
Those
It's
things
normal.
are luxury in pregnancy.
Yeah, so sweating a lot happens. So sometimes a woman's neck can get wet and she thinks, she's confused. Is it discharge?
Is
it sweat?
Is it the water?
Is it the water? But very important, which water?
Of
the baby.
Pregnancy.
Of the baby.
Hey, that one.
Yes.
Thank you.
Is it the water of the baby? So very important.
Yeah.
If a woman, you have an increased discharge and you're not sure about it, please don't even try to Google it. Come to the facility.
Don't be wise.
Don't be wise. Oba oli miezi meka, oba chi, oba no miezi mwenda, and people say, oh, do you know what? Yes, you're ready to give birth. It means you're almost giving birth. Nedda. Come and we check. Okay? Why? Because we need to see if it's the water coming from the baby, it means that there may be something wrong.
Yeah.
If that water comes early, sometimes baby is still young and we need to actually have you in hospital, give you some bit of antibiotics to make sure that you and baby are safe.
Yeah.
If that water comes at a point when you're almost giving birth, that's fine. Come and we monitor you. Tosigala waka, wala basigala waka naja after 1 week.
Actually, you mentioned something that sort of relates to my experience. Earlier before we started the podcast, I was telling you how I ended up having a C-section.
Yeah.
That I hadn't planned to have. And one of the things they told me is my water had reduced. The water that was holding the baby had reduced.
Yeah.
And the whole time, at that point, what I was thinking about is, at what point?
Did this water reduce?
Like, how did it reduce, people? Like, I didn't feel... You know movies, how they show the water breaks and then... There's
in
a
whole
flood.
bucket.
There's a flood
and
down.
then the man slides and falls in the water when he's hurrying to pick the bag.
Guys, I didn't have that experience. So for me, when they told me, your water reduced, I was like, how? Does it evaporate? But now that you mentioned the sweating,
yes.
I actually do remember, I think that was the week to giving birth.
Yeah.
I was already due birth. And they told me, okay, if it doesn't happen by this week, come back. Now, it's in that moment that actually that discharge was happening. And I didn't have a clue. I didn't have a clue. So now that you mention it, I'm like, oh.
It could have been the water.
It could have been that.
Yeah, so makes
Yes.
sense. Okay.
Yes.
So when did you decide to go to the hospital? After how long?
The whole time I didn't really pay attention to that. Because you see, I had like the discharge throughout pregnancy. So I was like, it's the whole thing.
But this time it was different.
But this time it must have been different. Like now I'm looking back in hindsight and that could have been the thing.
Yeah.
But I think I went to hospital after... Now, that is when I had seen the bloody discharge. And I had a midwife on call. I'm like, Hatsi, it looks different. It looks different. What could be the problem?
Yes.
And she's like, oh, yeah, now run to your nearest hospital.
Yes.
Have it checked. Let them do, what is that thingy called?
Cervical check.
Oh, yes.
Yes.
Guys, I hate that thing.
No one loves it.
Oh, my God.
It is the worst...
It's
examination. And
it's
unfortunately,
terrible.
science hasn't come up yet with something better for how to check mothers.
Science help.
They've tried scans, but still scans
They don't
haven't
help.
helped.
But yeah, so when they did that, I think they did it like at about 1 and I was at 2.5.
Yeah.
I called the midwife. She's like, okay, in the next 4 hours, be in the hospital, be ready and everything.
Yeah.
So I go to hospital. I get there, I think, around 9 p.m. and they check and I'm at 2.5.
You're still at 2.5.
And then baby's in distress.
So
And then water has reduced. I'm like, yeah,
many things occurring.
this child is on a rest.
The entire yoga went south.
You guys.
So, first pause.
Yeah, I'm pausing.
Very important. I want to upload the midwife that was able to take care of her. First, in Uganda, we advise if you have any emergency or anything's abnormal, run to the nearest health facility.
Yeah.
So you may be staying in Nagalare. Please
Country
run
house.
to your nearest health center here. It's always advisable that when a mother has something wrong in pregnancy,
Owachi otategedde mothers.
run to the nearest health facility. Nowhere Nagalale, run to your nearest health facility. Oba ya government, oba the private, please run to the nearest. Then after that, they will advise you and they will tell you, okay, do you know what? You can make it to the nearest what? Facility, or to your preferred facility for birth.
Yeah.
Or if not, if something maybe is up, they can tell you, Manyi, we have the help here, so we can first save you and your baby's life, and then we can make you move to your preferred facility. And the other thing, importantly, women, please do not wait for only blood. If something else is off, jangu. I don't want to mention is the blood. Blood can occur in pregnancy.
Yeah.
It's not normal. So most times like, yeah, omanyi batugamba ko nti obe olibuto bleedinga jangu mudwali bleedinga chi.
Let the doctor tell you that.
Yes, let the doctor tell you that, the midwife tell you that.
Yeah.
And if the midwife tells you that and you're like, they still don't feel comfortable. Please what? Come to the hospital. We have women who bleed usually like below in the first 3 months of pregnancy. It can occur, but please come to us and then we tell you this is okay, this is not okay.
Then just on that count before you even go.
Yeah.
It happened to me. After that, I got another pregnancy, and it happened to me that I started bleeding. But I was like, last time I also bled. You understand?
Yeah.
So I was like, last time it happened, I mean, my baby is here. It could be the same thing. Maybe that's how my body adjusts to pregnancy. And guys, I lost that pregnancy, not because I couldn't have changed anything, but because I kept referring to an old experience. So I think for me on that point is every pregnancy is different.
True.
Don't copy notes from the other side. Don't assume it's the same thing.
Exactly.
Go to the health facility.
Yeah. And most times if the bleeding happens in the first 3 months, really, it's not your fault that anything happened. Most times we can't prevent what happens. We usually call them rainbow babies. So yeah, that's a rainbow baby. And we pray for them.
Rainbow baby.
Yes, but that can happen. And if any bleeding also occurs after the first 3 months of pregnancy, very important, twagala kumanya. Where is the placenta? Most times placenta webe kulidde wansi. It means ekulidde where a baby ideally should be coming out from.
Okay.
So if the baby is pushing on it, sometimes it starts bleeding. Now you imagine placenta yewe omwana ekyokulya n'ekyokussa. So if it is bleeding, what does that mean?
The baby doesn't have anything to eat or drink.
Your baby may actually pass on.
Breathe,
So obeyango mchala, in case you have any condition like that, we can talk about it later. It's called previa or placenta previa or whatever.
Okay.
We can talk about it then. Naye waliwo abamu aba bleeding nga teri wansi naye nga alina ne pain awudduka emisindi. Okay? Don't be like kati nize mwami.
Don't even wait for the pain.
Don't even wait for the pain. Because sometimes that omwana we mabega separates itself from the uterus.
And these things we don't know as mothers.
Exactly.
Now, I'm a mother and I'm learning. So
So the placenta is the mwana we mabega.
Yes, the placenta thing. Like I'm learning that it can be at the front or can shift.
Yes, it can shift and depending on also where it is.
Okay.
So sometimes it can choose to separate itself. Normally it's supposed to separate itself after you give birth.
Yeah.
Now sometimes it just says, you know what? Peace out. I'm separating. But baby is still what?
Growing.
In. So the longer you take home, it means the more likely your baby is to actually die.
Yeah.
And it happens a lot.
Yeah, it does.
Now the one after birth,
that one.
she mentioned that she only,
2 weeks.
Only 2 weeks. That's expected, okay? But we also know, so what we call it in the medical term, it's called lochia.
Okay.
Call it fancy things.
Loca.
Loca.
Yeah. Lochia though.
So it's called lochia, okay? And that lochia changes, or we can maybe call it discharge, discharge, echuka color. It's okay, but very heavy. And women, bambi, I know you like maternity pads, okay? But your first 24 hours are heavy. The pads don't help.
Thank you.
Cotton. If your hospital provides that, please ask for cotton. And they always provide the cotton.
Yeah.
It's not because they are backward, because we haven't somehow thought about a very big pad for women, you know?
That heavy, kind of heavy pad.
Yeah. There are people that can, what they can use is a pamper, an adult pamper.
Thank you. I saw that in a video. You guys, YouTube, that's the one thing I learned from those videos that helped. Yeah.
So yes, cotton is very important because you bleed heavily in the first 24 hours. Yeah. But what is the normal bleeding? We say, yes, you bleed heavily, but why we are saying that's because most times when Muntabalo was like, I'm going to bleed like my period. It's heavier than the period. But
like 5 times.
Like 5 times. Interesting. Well, she confirmed like almost 5 times more.
I was shocked.
And interestingly, in Uganda, we are actually currently doing the PPH, what they call postpartum hemorrhage awareness month, which is August.
Okay.
Bleeding a lot after you have given birth. Now, your health worker knows what is the normal bleeding that is expected and what is the abnormal. It can occur in women who have given birth naturally and also women who have had a cesarean section.
That's the shock I got because I thought only those that have pushed
are the ones that bleed a lot.
Are the ones that are going to bleed. Guys, they just chopped here.
So how did
Where
I
is the
bleed?
bleeding coming from?
Yeah, so it actually also happens women who have had a cesarean section.
Yeah.
It's very important for women to deliver at the health facility. Some women can bleed a little bit and they think, okay, fine, I'm doing well.
Yeah.
But what happens after is they end up she's thirsty, okay? Those are signs that the body is actually going into shock. The actual shock that we mean now. The other things is she starts feeling cold, starts feeling as if they're not like with you, get confused, etc. Please
Rush her.
rush her. First of all, don't deliver from home. Don't deliver in Hajati's place, soba mamani.
But the problem is doulas. I don't know if you've heard about it. Abazungu balesewa akantu ka doula.
Dula.
Yeah, they call them doulas, but in Uganda, abazalisa. You know how we used to do the bazalisa thing at home?
Okay.
That used to
So
happen.
they are traditional birth attendants?
Uh-huh.
So these ones are modern
They're not
birth
traditional,
attendants?
they're now modern. They're now modern. Guys, we are still working with the same concept here of bazalisa. But I think,
Yeah.
and I've seen some mothers in the limelight also kind of support it,
Yeah.
which I don't think is a bad thing because that's someone to work with in pregnancy. But I want to encourage a mother, don't cut out the health worker.
Good.
Do not. Even if they are to be doulas,
Yeah.
let them have that expertise in health. Let them be trained by a health worker.
Very
have supervision of a health worker.
Exactly.
Yeah.
Attend your antenatal care as you should.
Yes.
Do deliver from a health facility. I've attended to a mother before who had a birth doula in a hospital and it was okay. And together we would communicate with the mother.
Yeah.
We communicate and say,
It
so
makes
this is
the
happening.
experience
Yes.
comfortable.
And the doula was actually a supportive person,
Yeah.
not someone to come and say, Neda. They're not supposed to do that to you.
Ababasawo balimba.
Abasawo balimba.
Guys.
The doula is someone who should be able to explain to you something.
What the doctor is
Hey,
saying.
what are they
what
saying?
The
You've chosen to
implications
trust them.
are.
If you don't
Yeah.
trust your doctor too much, you don't trust your midwife too much, please. Then the doula can also help you understand that part. However, Ugandans, please do not deliver from home because you have a pregnancy. What?
Doula.
Our policy is kuzalira mu ddwaliro. We are not in modern countries or like high income countries where you can get an ambulance next to you in the next like 5 minutes. Even if you're in Kampala, you have
Jamwe
access
Kampala
to what?
ng'omuyisewo.
Jamwe Kampala ogenda muyiza. Ogenda kuzalira mu mmotoka. So, and you can even get a complication. Your
Yeah.
baby can get a complication and you don't have a way. So it's not because we expect complications all the time. No, it's called preparing for emergencies when they
Precaution.
happen. Precaution. Taking precaution.
Commercial
Okay.
break.
So now what happens when you get to the facility? Now we talked about the locker part.
Yeah, the
so,
locker.
Yes. Now the cotton, when you bring it, that's why you say mama kit has that big cotton and gauze. It's very good for soaking up that discharge after you've given birth. After the first 24 hours, we know how much is not too much.
Yeah.
If you've bled more than 500 mils and you've just delivered vaginally, that's what we call too much. That's what excessive bleeding. And they know how to check for it.
Okay.
Most times what we advise mothers to do is this. Whether you've pushed or even if you have given birth via cesarean section, we advise that if you're changing more than 2 pads, full cotton pads in just 2 hours, raise the alarm, okay? Don't wait to feel tired. Don't wait to feel thirsty,
disoriented.
Don't wait for those things.
Yeah.
Immediately.
Immediately.
Something is wrong.
And the good thing, if you're in a health facility, it can be arrested
Exactly.
earlier.
It can be attended to early.
Thank you.
And it can be, and that's what actually by the way kills mothers. Because like you're losing blood, but you're with people like banaga, mani mpulira nyonte nnuma. Pala baya muletayo ku mazzi, chibaawo ngomaze okuzaala, muletayo ku chi. The next thing you know is the woman is white, etc. Now someone may ask, but she's in a health facility. Why are the health workers really checking on her?
Yeah.
Well, we know that in our healthcare system, we don't have a patient ratio of 1-to-1. Even in a facility where you have like a doctor-patient ratio or a midwife-patient ratio of 1-to-1, you may have those subtle things missed. So yes, you've given birth, well, they've attended to you, now they're dressing up your baby. But in those 30 minutes, something is going on. You're bleeding too much.
Yeah.
So sometimes that's why I also encourage you have a supportive companion during pregnancy and also during childbirth, even if it's after cesarean section. But you need to have someone attending you, someone not scared of like attending to you, someone who's not scared of who you're not scared of. There's that part. Now what happens after 24 hours? Usually after 24 hours, well, the bleeding somehow reduces. Now that's why you can actually use the maternity what? Pads. Still maternity pads, you can use them up to like maybe like 3 or 4 in a day. Expect to use more than what you use during your period.
Yeah.
Because, well, the bleeding is more. However, After that, it goes down, and then now the lock here, okay, starts from being very red, starts going slowly by slowly, then becoming like pinkish, okay? That pinkish can stay for up to like 1 week. Then after that, you start getting like a heavier discharge, that's maybe like yellowish, webacho. It's all your body building up, okay? Your womb building up to where it was. Now, that can continue. For most women, it's like up to 2 or 3 weeks.
Yeah.
But for some women, they may have this up to even 6 weeks. Others may even experience it even after. So that is why they call it the postpartum period, the fourth part of pregnancy.
The fourth trimester.
And no one tells you.
Fourth trimester.
The fourth trimester. Everything
it's
is
real.
happening. Eh? Everything is
It's real.
Everything is discharging.
Yeah.
Bichimuchi data. Once you are
Everywhere.
You're sweating everywhere. And the baby must feed.
And you must carry the baby.
And then also the eyes cry. Women break down during this period because we talk about it less, okay? But we hope that the more we talk about it, raise awareness about it, and what is expected. And ladies, you're allowed to ask your doctor or you're allowed to ask your midwife, what is going to happen to me after I give birth? Okay? Because we know there are some expectations. So you're allowed to ask her, no, okay, katinteke kachi, bichi, even if you're 4 months pregnant.
Throughout your antenatal. Because that's the point of antenatal, guys.
Exactly.
It's not for you to just go there, call a test A, B, C, D, E. You take your fancy da. Do the scan. Come, we measure manyomana to say the heartbeat. No, as you're having those examinations, actually interact with the midwives, interact with the personnel you have before you. You're seeing something different, something looking funny. Because I remember one of the funny things that happened to me is it wasn't rash. It's like I had pimples from my stomach and back. All of me. And I was like, is this normal?
And then they say,
because she was checking. I was like, is this normal? She's like, sometimes it happens. But for how long has it taken? And I was like, it has been there like for a week. She's like, okay, maybe you may need to add a tube just to kind of ease up on the irritation. But you see, that is with you engaging with the medical worker. And that's a journey. And
what people don't know is this, or maybe what people think they don't know or they know. A doctor or a health worker to work on you well, you have to tell us.
Like, you have to say.
Oh, then we know. Eh? But you don't just assume that because you've come and paid a consultation or you've gone maybe to the facility, it's a government facility, they've attended to you, that the health worker is actually
will tell
going to
you
know.
everything you want. Because even you as Dr. Ruth, even Dr. Ruth doesn't know what's happening to my body. So until I say, her expertise is only of importance to you as a mother after you engage. Because you will not know what she knows. Now, if I didn't know which part again, the placenta that can shift, you know? So how would you know that when the bleeding starts and you're like, guys, let me first run to hospital. Musau, I am bleeding and I've not yet given birth. I am so and so months pregnant. What could be the problem? They will be able to check and now tell you that in real time. Not after things have happened, not after you're broken down, not after you've even lost your child.
But sometimes when we feel bad patients, we feel very bad. We're like, you guys, we've been with you the whole journey of pregnancy. Or we've been with you through your delivery time. You've now gone home. You could actually even just have sent a text. You could have called. You could have come back for a checkup. And, amazingly, women think after giving birth, that's it.
Tumaze, Musao, peace.
Hey, now, we talked about the fourth trimester.
Yeah, and it's real, guys.
It is real. Usually we were saying it's up to 6 weeks.
Yeah.
But now we are like, you guys, it's up to 12 weeks. And in Uganda, even actually, other low middle income countries or other countries actually go up to 6 months. That's when we expect that your body's changes that have occurred during your pregnancy have now gone back.
Yeah. I didn't know you can even get high blood pressure after pregnancy when you didn't have it during pregnancy. Because I didn't have it.
Postpartum period.
Thank you. Because I didn't have that blood pressure during pregnancy the whole time. Guys, I went for all my antenatals from the 1st month to the 9th month. And on all of them, my pressure was top notch, perfect, no fear, nothing. And now when I gave birth, to the extent that I had to remain at hospital an extra day to monitor my pressure, it was through the roof.
Yep.
Never happened to me. I've never experienced it in my life.
That can happen, and it's not brought about because you had a cesarean section. No, it can happen.
Not,
And that is called preeclampsia. We shall talk about in another podcast. We shall have Martha.
We're just going to give you new words every day.
Very new words.
Today, look here.
Preeclampsia mu different languages. But anyway, what is high blood pressure in your language? You can tell us on the next podcast.
Tell us, even in the comments. You tell us.
So
what
now,
these things mean to
we
you?
talked about the discharge, and we said, well, we know what is the normal bleeding, and we've advised Obango bleeding anyo, that is more than 2 pads in the first 2 hours. Please
raise the alarm.
Yes, but what else can be abnormal after you've left the health facility? Okay, if that discharge comes nga ewunya, that's not okay. If it comes and you're now feeling pain, that can happen, but it's also not normal. That's why we always check. That's why we always
I'm dwaliro.
Again, I'm dwaliro. It's true. But sometimes you can actually experience bleeding a lot even after the first 24 hours.
Yes.
And that's why we also call it secondary PPH. Now, PPH is a postpartum hemorrhage.
PPH.
Remember, this
secondary
is August. Yeah?
Erimu secondary level tuva primary entering second.
Kati primary kekasoka mu 24 hours wakazala okyali mu ddwaliro. Now after 24 hours, this bleeding can also happen. It's not because you're a bad mother, it's not because you have a bad body.
It's not because your body is not good.
Exactly. It just happens.
It's not because you're fat.
It's not because you're small.
It's not because you're short or tall.
So because you're
okay, but you get the point.
You have a uterus, okay? It can happen.
Yeah.
So I think the someone has to look out for is that. And the other one is also fever. You've
talked fever.
After you've gone home, please come to us. Yes.
And even the caretakers that are taking care of these mothers. Me, I was fortunate enough. My midwife is also a relative, so she was here for an entire week. But if you realize that the mother is having these problems, and like you talked about, those people go tatia, they can change you, they can help you dress. Sometimes even the mother may not realize. You get so carried away by the child, and you're like, now you are having all these pressures, but you're not paying attention to your body. So people that are there.
And as you were saying that, I remembered a very important question. Cameraman, camera watching body microphone. Sijikona na microphone irabika ngenzirukako. Kale. Kiriya. Very good. So, as you're talking about things to do with like self-care, we can talk about that in our next podcast, self-care for mothers.
Self-care for mothers.
After you have given birth.
Yeah.
Now, that's a very important thing called okwe picha. When do I actually have sex after I have given birth?
Not immediately. Not after 1 week. Not after 2 weeks. 3, not advisable. But doctor can advise us. Thank you very much.
Thank you very much, Martha, from your expertise. As a patient, I will say,
fire.
Number 1, if a woman is still bleeding, it is safe not to have sex, okay? First, wait for the bleeding to clear.
You shan't die.
Yeah, no one will die because they didn't have sex during that time. Second is if you have any sexual intercourse with your lady and then she has any funny smell after that, mugambeko, okay? Mugambeko, honey, there's something off. And that could be actually one of the things that can help with letting her know something is wrong and you run to the health facility. She may be having an infection from the womb, okay? Yeah. And that's why the discharge changes. Now, when should you have sex? When you are comfortable, okay? When the mother is and when the father is comfortable.
Especially the mother.
Especially the mother, okay?
It's important.
Still bleeding, please. Let her first heal. Let her body first heal.
Even when she has stopped. When she's comfortable.
So it is normal for women to fear sex after birth.
I didn't fear. I dreaded it. I feared it. I was scared of it. I was not aware. It is very
normal. And if a mother outside there is very scared about sex after birth,
we are too.
It is a normal feeling. It's a normal feeling. We shall have a whole topic about sex after birth. What if Bansa say, can I have
and that one sex? I shan't come. But yeah.
It is okay. That one I can't even be alone and talk about it. It is a very important topic because this breaks down families. And the commonest question, by the way, in the consultation room, after the women live like this, if they've brought their husband, please always bring your husbands, even postpartum visits.
Sneak in.
The husband asks Musao, kati nkubuza ke chibuze
Ama when.
Kati when. Waliwo mugwe nagamba yangamba ali Musao kyotegeeza kati nzo kikubaliro. Shout out to that mister, but yeah. Okay, but the woman felt shy, but it is well. Now, when the woman feels comfortable and the man also feels comfortable, please, that is when you can have what? you can have sex.
Yeah.
If she's bleeding, please do not what?
Attempt.
And usually if a mother has also had like more like a tear down there, please, it's advisable to actually wait for even like
Until
up to
the
6 weeks.
healing.
Okay.
Yeah.
Up to 6 weeks, we expect that everything is safe then. Thank you very much. I hope you enjoyed our podcast.
I hope you did.
Thank you very much
Thank
for
you,
coming
Doctor.
today.
It was a cool one, guys.
It was a very nice one.
It was a cool one.
And please follow us on our YouTube pages at Sauti Media Plus and then also at Dr. Ruth Grace. We
Yeah.
are going to be willing to open up and share more with you about what is it that you want to know about your self-care, about
Yeah.
safe motherhood.
Yeah.
Is it about what we've talked about today? What tutategedde? Tubuulire mu comment
Ask.
section. You can also follow us on our TikTok pages at Sauti Media Plus and also at Dr. Ruth Grace. Comment and then we shall be able to reply to all your comments and share as well for other mothers to learn and also other women to also know and the men to also know that you can have sex after birth but only when she is comfortable. Thank you.
Thank you very much. Peace.